Discussing about necrotizing enterocolitis. So necrotizing enterocolitis means, so itself here is a term. Necrotizing enterocolitis means, entero means that intestines, okay, colitis means inflammation is going over there, okay. That means what? There is acute ischemic necrosis of the intestine. That condition is called as what? That condition is called as necrotizing enterocolitis, okay. It occurs among small premature infants, often those less than 32 weeks. The clinical picture mimics neonatal septicemia because of the presence of abdominal distension, apnea, bradycardia, instability of the temperature, cyanosis, and lethargy. Okay, NAC is believed to result from interaction of several factors such as cord immaturity, mucosal injury due to hypoxia, ischemia, milk feeding, and infections. Antenatal steroids and breastfeeding protect against NAC, that is necrotizing enterocolitis. Delayed enteral feeding does not prevent NAC. Okay, so clinical features of this necrotizing enterocolitis depend on three stages: stage 1, stage 2, and stage 3. Okay, stage 1 means suspected NEC. So unstable temperature, okay, there might be unstable temperature, okay, there might be apnea, bradycardia, lethargy, mild abdominal distensions, vomiting, frank or occult blood may be present in stools. Okay, X-ray shows mild intestinal distensions. Okay, suspected NEC means unstable temperature, apnea, bradycardia, lethargy, mild abdominal distension, vomiting, frank or occult blood may be present in stools. Okay, X-ray shows mild and intestinal distensions. Stage 2 means clinical signs are similar to stage 1. Bowel signs are diminished with or without abdominal tenderness. Okay, so clinical signs are similar to stage 1, but here what happens, there might be abdominal tenderness with or without abdominal tenderness. Okay, that means bowel sound are diminished with or without abdominal tenderness. Okay, there is one of the most important things that is called as nematosis intestinalis. Okay, and dilatation of the intestine are seen on abdominal X-ray. Okay, in addition to above, the infant is severely sick with hemodynamic instability. There are frank signs of peritonitis with abdominal wall redness. Okay, pneumoperitoneum may occur due to intestinal perforations. So stage 1, stage 2, stage 3, there is in stage 2 there is bowel sound are diminished with or without abdominal tenderness. Nematosis intestinalis catch in intestinal wall, and dilatation of the intestine are seen in abdominal X-ray. Stage 3 means, in addition to the above, the infant is severely sick with hemodynamic instability. Okay, there are frank signs of peritonitis with abdominal wall redness. Okay, there is pneumoperitoneum may occur due to intestinal perforation. Okay, so you can see over here necrotizing enterocolitis, dilated bowel loops, and nematosis intestinalis. Okay, you can see over here. Okay, there is dilated loop, there is nematosis intestinalis. Okay, there is gas over here. Okay, so this is called as what? This is called as necrotizing enterocolitis. So management, okay, so management can be done with the help of oral feeding should be withheld. A nasogastric tube is inserted to relieve distension and to aspirate stomach contents. Okay, first thing is oral feeding should be withheld. Nasogastric tube is inserted to relieve distension and to aspirate stomach contents. Okay, fluids and electrolyte in adequate quantities will be administered. Okay, so parental nutrition may be administered. Blood, CSF, urine, stools are cultured. Shock is managed by replacement of fluids. Use of vasopressor agents. Platelet in plasma and platelet transfusion may be necessary to prevent bleeding tendency. Perforation is suggested if there is free intra-abdominal gas and liver dullness is obliterated. Okay, surgical intervention is required in this case. Okay, normally surgical intervention is required in stage 3. Okay, so in this way we can manage necrotizing enterocolitis. Okay, necrotizing enterocolitis means that occurs less than 42 weeks. That means there is acute ischemic necrosis of the intestines. Okay, so we have 3 stages: stage 1, stage 2, stage 3. In stage 2 there is bowel sound. Okay, so these are the things over here: stage 1, stage 2, stage 3, and stage 3 needs surgical interventions. Okay, and then this oral feeding is withheld, and nasogastric tube is inserted to relieve distension and to aspirate stomach contents. Okay, so this is the things over here. In this way we have completed necrotizing enterocolitis. Thank you.